Welcome to Healer.com. I'm Dr. Dustin Sulak, and if you're watching this in a cannabis dispensary or a healthcare office, you're probably in the right place. Healer.com will give you the guidance and education you need to navigate the often confusing world of medical cannabis. So if you're new to cannabis, just allow us to help you make the most of this medicine. And if you already know about medical cannabis, we're going to be able to share some new and exciting things with you that'll take your health to the next level. The most important thing I want you to know is that cannabis is a safe medicine, especially if you use it correctly and get the right dosage. Cannabis is a broad therapeutic medicine that can work on many different conditions and parts of the body because it interacts with the endocannabinoid system. This is a system of physiology that's crucial for health and healing. We all have it inside of us and it's active throughout our entire lives. Cannabis is unlike most other medicines because it often has stronger therapeutic effects at lower dosages. We'll show you exactly how to find the optimal dosage for you so you can use the minimal amount of cannabis, have the most health benefits with the least side effects. I want you to feel comfortable with your experience with medical cannabis and to have the knowledge to effectively navigate the system and have a successful, optimal therapeutic experience. So I'm going to give you an overview of the most important topics, but if you'd like to learn more in-depth information about medical cannabis, just give us your email and we'll send you some great information. Medical cannabis can be administered using a number of different delivery systems, and each one has its strengths, weaknesses, and clinical utility. Let me give you an overview of the different delivery systems so you can understand what each one might offer you. Inhalation is one of the most common ways to take cannabis into the body, and you can inhale cannabis via smoke or vapor. A vaporizer is a device that heats up the herb to a temperature where the medicine vaporizes and you can inhale it in, but the plant matter itself doesn't burn. So when you use a vaporizer, you're not exposing your lungs to the products of combustion and potential carcinogens. Vaporizing is a lot easier on the airway, but either form of inhalation will give you the fastest onset of cannabis. That's useful for getting quick relief from your symptoms and for being able to determine what's the optimal dose for you, because you'll feel the effects so quickly you'll know if you need another administration or not. When you inhale cannabis, you'll start to feel the effects within 1 to 5 minutes, and they'll last 1 to 4 hours. Tinctures are a name for liquid extracts of cannabis, typically dissolved in alcohol, but you can also find tinctures made of oil or glycerin. These liquid extracts can be placed in the mouth with a certain number of drops or milliliters and absorbed through the blood vessels in the mouth or swallowed and absorbed through the gastrointestinal tract. If you hold the tinctures in your mouth, it will take 5 to 15 minutes for them to kick in, or at least start affecting you, and the duration of tinctures is a little longer than inhalation, usually 2 to 6 hours. Topical cannabis preparations, like cannabis salves, are an excellent way of treating local pain, inflammation, or itching on the skin. You can just rub a cannabis salve into the area that needs it, and you can get a local benefit there without a systemic effect. Salves are great for people that don't want the psychoactive effects of cannabis. If you use a strong enough salve over a large enough area of your body, you actually can start to feel the euphoria or psychoactivity, but that's rare. Some topical salves or transdermal preparations are designed for systemic absorption, so you can put them on your skin and get a full body effect. Cannabis edibles or capsules or any form of cannabis that you swallow and absorb through your gastrointestinal tract will give you the longest duration of action. That can be really useful for using before bed to help you sleep all night, or for getting a long effect during the day, 4 to 10 hours. The onset of edible cannabis is much slower, and this is where you have to be careful. Once you swallow cannabis, it might take up to 2 hours before you even begin to feel the effects. And that onset could be different from day to day based on how fast your digestive system is working. The most common mistake people make is having an edible, waiting only a half hour, thinking that it's not working, and then taking another one and having too high of a cannabis dose. We'll tell you more how to deal with that and how to avoid that in some of our other videos. Raw cannabinoids are in an acidic state, and so they're called, for example, THCA, or THC acid. THC acid has physiologic benefits like reduction of inflammation and reduction of pain. I've witnessed this in several patients. Patients can literally take a very small amount of a raw cannabis bud and eat it, or use a tincture that's been specifically produced to preserve the acidic state of the cannabinoids. There's another cannabinoid that a lot of people aren't talking about called THCA. This is actually the raw, unheated state of THC. And THCA has been surprising me by how well it's been working at such incredibly low doses. Some medical cannabis producers are now making suppositories that can be used rectally or even vaginally. And these preparations may be ideal for treating problems in the pelvis or low back. The actual formulation of the suppository is important, and it will affect how well the medicine is absorbed. So these products can vary quite a bit from one preparation to the next. The single most important factor in having an optimal therapeutic experience with cannabis is finding the right dosage for you. And cannabis is different than other medicines because a healthcare provider or someone that works at the dispensary can't tell you what your perfect dosage is. But after I've worked with thousands of patients, I've developed a program that will help you quickly and easily determine your optimal dosage so that you can get the most benefits from cannabis with the least side effects. When you go to acquire the cannabis medicine, you'll probably be amazed by how many different choices there are of all the different strains. The strains all have different names and different medical properties, and they're usually divided into 3 or 4 major categories called indica, sativa, hybrid, and CBD dominant. Indica strains grow from shorter, bushier plants and usually have a more fruity aroma. They tend to be more relaxing, more sedating, and often better at treating pain. Sativa strains tend to be more energizing and uplifting. They grow from taller plants, and they usually have a more spicy aroma. Hybrid strains are designed to give you the best of both worlds, and they may combine some of the qualities of an indica and a sativa strain together. Finally, the CBD dominant strains have the medical properties of cannabis without the intoxication or psychoactive effect. These strains are ideal for people that want to experience cannabis without getting stoned or high, with even enhanced medical benefits. When you're looking for the right strain, you could choose based on one of these categories, or I encourage you to talk to the cannabis producer and ask them, what do other people with the same condition as you respond best to? For example, if you're trying to treat back pain, just ask, what do people with back pain report works best? You could try 1 or 2 of those different strains and see what's optimal for you. While cannabis is an incredibly safe medicine, there's a few things that I need you to know to make sure that your use is even safer. Number 1, don't drive or operate heavy machinery until you know how a certain dose of cannabis is going to affect you, the same way you would with any other medication that's new to you. A lot of people ask about cannabis addiction or dependence, or the potential for withdrawal symptoms when stopping cannabis. Studies have shown that high-dose cannabis users who stop abruptly do get some withdrawal symptoms, but these are usually quite mild and comparable to what people experience when they're stopping caffeine abruptly. Things like trouble sleeping, decreased appetite, maybe irritability. But all of these symptoms are usually limited to the first week and are mild. For people that have had addictions in the past and that believe they're susceptible to becoming addicted to substances, I encourage you to use cannabis under the guidance of a medical provider who knows what they're doing and understands how this herb works. because when used appropriately, cannabis has been shown to help people decrease their use of many other harmful substances and break that cycle of addiction. After you try several different strains of cannabis, you'll probably find one or two strains that seem to work even better for you than all the others you've tried. When you find these, I want you to pay close attention. First of all, smell their aroma. A lot of the compounds that modify the therapeutic activities of these strains actually have pleasant odors, and you can learn to recognize strains that will be better for you just by the way they smell. When you find a strain that works really well for you, take it to an analytical laboratory that specializes in cannabis so you can find out which cannabinoids and terpenoids are in that strain, and you can get a better idea of which of the therapeutic compounds of this plant agree best with you. Thank you for your time today and for allowing me to guide you in the basics of how to use medical cannabis. I hope you'll allow me to continue deepening your relationship with this plant. On healer.com, I've developed programs that will teach you how to find the optimal dosage, how to use cannabis without psychoactive effects, how to reverse tolerance if you've built that, and many other ways for you to deepen your own connection with your health and improve the quality of your life.